Good evening and welcome to Tucker Carlson tonight. For so many people, it was a very long weekend. We hope you made it through and thrived with the ones you love. By many estimates, a lot is going to change this week. We hope they're wrong, but they're telling us that will especially be true in the country's largest city. Of America's 42,000 confirmed cases of the Chinese coronavirus, fully half are now in New York, and the number is growing by the thousands every day.
Number of positive cases, we are up to 20,000 statewide, 5,000 new cases, which is obviously a significant increase.
So for perspective on that number, just 2 weeks ago, there were not 1,000 cases in the entire country. Tonight, a single state can add 5,000 cases in 24 hours. Steep curve. This morning, the Surgeon General of the United States predicted the worst is yet to come.
I didn't expect that I'd be on the Today Show for such a somber occasion. I want America to understand this week it's going to get bad, and we really need to come together as a nation. I heard the stories that you were just playing. Young people out on beaches. We see here in D.C. that the district set up a cam for people to watch the cherry blossoms. You look on the cam, you see more people walking around than you see cherry blossoms. And this is how the spread is occurring.
It's going to get bad this week. So what does that mean exactly? What could that look like? Well, in Italy, which is maybe the best model we have, deaths peaked on Saturday. There was a death toll of almost 800 that day. So scaled to a country the size of ours, that means 4,000 deaths a day. That's more than the number of people killed on 9/11. So in the face of this threat, which is profound, we have shut down the country by and large. For more than a week now, millions of Americans have been ordered to stay in their homes. This was not done lightly. Medical authorities believe isolation is vital to slowing the spread of the disease. Many of them have been thinking about this question and planning for pandemics for decades. What we're doing now, or trying to do, grows from as close to a consensus as you're going to find in science at the moment. We've quarantined much of our population because informed people thought we had no choice. It was a decision, whatever else it was, that was made in good faith. But there's another side to that decision. The shutdown has come at a terrible cost for an awful lot of people. Millions of Americans have lost their jobs. An economic crash clearly looms in the near distance, and that's not a small thing. It could change this country forever, more even than the virus itself. Americans have never been more grateful for their doctors and their nurses and their scientists, and for very good reason. These are the people working and exposing themselves to great risk to save us from the scourge. But the truth is, you can't just let epidemiologists run a country of 320 million people, just as you would never turn America over to a team of economists. Not because they're bad people, they're mostly good people, but they are specialists, and their range of vision is too narrow. As in everything, you need balance. So what's the right balance here? How do you keep Americans from dying of this plague, which is essential, while preserving a strong and independent country for your children and your grandchildren? We're paid to formulate very clear views on things, but the truth is the answer to that question is not clear right now. And anyone who tells you it is, anyone you see peddling pat answers on television, is either misleading you on purpose or hasn't really thought about it. It's a very tough question, and answering it correctly is vital. So tonight we're going to do something we've never done before. We're inviting on two guests who have essentially opposing perspectives. But they're not here to debate. We respect both of them. We believe they both want what is best for this country. So listen to them, and maybe the answer will become a little bit clearer. Joining us first is Dr. Brendan Carr. He's the chairman of the emergency medicine at Mount Sinai Hospital, and he joins us tonight. Doctor, thanks a lot for coming on. So
thanks very much for having me.
We haven't, of course, imposed a nationwide lockdown. We've done it in some places. Judging from the numbers that are available from those places, do you think it's doing what it was supposed to do? Is it working?
It's a good question, that I think we just don't know the answer to yet. We have to remember the lead time on this virus is pretty long. The median time that people feel symptoms is 5 days. Most will have it by 11 days after an exposure. So our social distancing experiments have not been the full duration that we would need to see a change in the slope of the new incidence of disease.
So give us a sense, purely from a medical perspective, leaving out economic or social considerations, but if you're an epidemiologist trying to slow the spread of the disease, how long would a quarantine need to last to be effective, do you think?
Yeah, I guess there's two pieces. One is how long it would need to last, right? And we would need to see the slope of the curve change, right? We've been waiting. All of us have been waiting for this curve to change. But the second piece is we need to be thoughtful about how well we're doing it, how well we are actually following the rules and trying to distance ourselves. I'll tell you, I've been in 6 of our emergency departments in the Mount Sinai Health System in New York City over the last couple days, and it is. It's always a stark difference to leave the emergency department where you have very, very, very heavy conversations and make hard decisions with folks, and then go out into the public and you see people enjoying life. It's even more stark and more exaggerated now to see that contrast, mostly because the frontline providers are afraid, and we're the last line of defense. We need that first line of defense. We need the social distancing, which seems so easy, to help us.
I think that message has definitely penetrated to most people who are paying attention, but maybe some of the details haven't. So if you were in charge of the response, and again, just looking at this from a purely medical perspective, how do you keep more people from getting this and dying from it? What would that look like? How long would it be, and what would it mean specifically?
Yeah, I mean, I wish I could tell you the answer. The truth is, until we see a change in the number of new cases, until it's going flat or going down, no one can make that decision. We have to reassess all the time as we see the slope change. I'm sorry.
No, that's a very telling decision, because you're hearing people act as if they know the answer, and it's interesting to hear you confirm that it's a moving target.
It is very much a moving target.
Tell us finally what quarantine would actually look like. Would it mean literally staying in your home and not leaving? Is that the only effective way to do it?
Yeah, the limitations that have been put out are pretty, I think, reasonable to most folks. A little bit of exercise, the grocery store, the drugstore. I think that is a really good place to start. I just don't think that we're necessarily really there yet. Most of us, and I include myself. I'm thoughtful about it all the time. I feel like I'm allowed to go to work, and while on the way to work, maybe I'll stop and grab a couple of things from the grocery store. I could probably do that less frequently. I could probably cheat just a little bit less.
Well, you certainly get a pass for leaving your home. Doctor, thanks so much for that. I really appreciate it.
Yes, sir.